Image description. The Charge Educational Checklist presented by Lily Slavin, MA, in large print in the title box. Underneath are 5 agency logos. First is the WDB TAP logo, West DHH, Wisconsin Deaf Blind Technical Assistance Project, WDB TAP, includes a blue circle in which a small white hand is in front of a larger black hand. Next is the Project Reach Illinois Deafblind Services logo. Project Reach Illinois Deafblind Services is written in curved print. Underneath is written, "Serving youth who are deaf-blind, their families, and their schools." To the left of the print is a graphic figure, no specific gender, of a child in a cap, an arm extended holding a ball. Next is the DB TAP logo. A black graphic in the shape of the state of Missouri contains a white line drawing of a smaller person touching hands with a larger person. The letters DB TAP are underneath but contained within the shape. Next is the logo for the Delta Gamma Center. DGC Kids is above Delta Gamma Center for children with visual impairments. The final logo in the row is Central Michigan University. Large black CMU are above the word Central Michigan University. Underneath all 5 agency logos is the Ideas That Work logo and disclaimer. Print logo in red and blue reading Ideas That Work, Office of Special Education Programs. Ideas That Work is circled by a curved arrow. The contents of this presentation were developed under a grant from the U.S. Department of Education, H326 T180044. However, those contents do not necessarily represent the policy of the U.S. Department of Education, and you should not assume endorsement by the federal government. Image description. A Zoom meeting screen photo with 6 participants in 2 rows. 3 participants per row. Row 1 shows photos of Megan Burgess from the Missouri Deafblind Technical Assistance Project, Becky Lambert from the Delta Gamma Center in St. Louis, and Ruth Ann, our interpreter. Row 2 shows photos of Lily Slavin, today's presenter, Michelle Klein from Project Reach, and Jen Gettleman from the Wisconsin Deafblind Technical Assistance Project. Well, good afternoon, everyone. I am Jen Gettleman, and I'm the deaf-blind consultant on the Wisconsin Deaf-Blind Technical Assistance Project, or WDB TAP. Here with me today are Michelle Klein from Project Reach, Megan Burgess from the Missouri Deaf-Blind Technical Assistance Project, and Becky Lambert from the Delta Gamma Center. We would like to thank you for joining us today for the Charge Educational Checklist webinar. Before we get started, I just wanted to go over a few logistical details. First of all, because of the tremendous response for this presentation, we're providing access through Zoom, YouTube live stream, and we'll also be recording the presentation for later viewing. The recording will be posted through our various state deafblind project websites or YouTube pages. For accessibility for this presentation, there will be both captioning and interpreting. To access the captioning on Zoom, you should see a closed caption button that you can click on, and then it should stream automatically to YouTube with how we have it set up on Zoom. As questions come up, please feel free to submit them, and then we will share them with Lily so she can answer them. If you're on Zoom, if you could just submit those to the question and answer button at the bottom of your screen, that would be wonderful. And if you're on YouTube, just please put those questions in the comment section, and we will be monitoring that and communicating that with Lily. We will be doing a few polls throughout the presentation. So if you're on Zoom, the poll should just automatically pop up on your screen, allowing you to click on the answer. These polls will also be read aloud so that those of you who are on YouTube or anyone who does not have access visually to Zoom are able to participate. If you do not have access to the poll, please just share your answer through either the chat or the comment section. So let me launch the first poll. And so the first poll just asks, how did you hear about this presentation? An email from the State Deafblind Project, the State Deafblind Project Facebook sites, the State Deafblind Project website, the Delta Gamma Center, the Lighthouse for the Blind, Illinois Advocates for Deafblind, Midwest Charge, an early intervention group, your state's charge liaison, or other. And if you wouldn't mind, if you selected other, if you could just let us know, maybe in the chat, how you did hear about us. And I'll leave that open for another minute or so. Lastly, at the end of the presentation, we will share out a survey for you to fill out. We just ask that you take a few minutes to fill this out, as it really does help us to provide you and your school teams or educational teams with what you need. Linked to the survey is the option to receive credits or a certificate of participation for this presentation. If you are wanting ACV REP credits or Illinois Educator Professional Development credits, which were formerly known as CPDUs, we will be sharing 2 code words in the chat you will need. One of those will be shared right now, and then the other will be shared at the conclusion of the question and answer portion of the presentation. So Megan's going to be sharing that on Zoom. And once I'm done talking, I will be sharing that on the YouTube page so that you have access to it as well. When you registered, we did ask if you're working with a student who is on your state deafblind project. And about 45% of you either responded with a no or an I don't know. So we just wanted to quickly give you an overview of the support the state deafblind projects are able to provide children with deafblindness, their families, and their educational teams. The goal of the state deafblind projects is to provide a range of services to improve results for children with deafblindness and their families. They work closely with early intervention and education providers to address the high intensity educational needs of children who are deafblind and prepare them for a successful transition to adult life. The deafblind projects facilitate family involvement in education and transition opportunities. They also collaborate with OSEP-funded parent training and information centers. The state deafblind projects conduct activities to increase early identification and referral, and they also promote access to and progress in the general education curriculum and grade level academic content standards. In the email that you received with the links, you should have also received a link to a resource folder. So along with a list of links for the state deafblind projects that's in there, there are also today's presentation, the charge checklist, and other information about the Wisconsin, Illinois, and Missouri deafblind projects and the Delta Gamma Center. That will be put into the chat now so that if you did not see that in your email, you can access it now as well. And now I would like to introduce Lily Slavin. Lily is a school psychology doctoral candidate at Central Michigan University. She has been a member of the Charge Syndrome Research Lab, led by Tim Hartshorn, since 2016. Her research interests include educational needs, supports, and experiences of students with CHARGE syndrome. She has presented at CHARGE conferences in Norway, Germany, Florida, Texas, and Cincinnati. Lily has also worked as a summer intern at Deafblind Central and as a summer research fellow at Cincinnati Children's Hospital with the CHARGE team. So I'm going to turn it over to Lily. And as I'm doing this, I'm also going to post another poll just to see what your previous knowledge of the CHARGE checklist is. So the question in the poll is just, have you heard of or used the CHARGE educational checklist before? So again, if you do not have access to the poll on Zoom, just please put it in the chat or the comments. Image description: maroon title page with white letters with the heading of CHARGE Research Lab and the Central Michigan University logo, which is in large black print letters. CMU are above the words Central Michigan University. A white line divides the heading and the title of this presentation: an educational checklist for individuals with CHARGE syndrome. Lily Slavin, M.A., 8-10-2020. A white line drawing depicting a person in a lab coat looking through a microscope is to the right of the title. This slide also contains 2 photographs in a vertical line to the right of the screen. The first photo is of Ruth Ann, the interpreter, which is placed above the photo of the presenter, Lily Slavin.
Yeah, thank you so much for having me today. I am always excited for an opportunity to present on this topic. It's something that I've spent the last several years of my graduate experience devoted to, and I think it's so important in my work. Every chance that I get to talk with professionals and with families and collaborate with deafblind projects, it's really, really important to me. So I'm really excited for this opportunity. Like Jen said, I'll be presenting on an educational checklist for individuals with CHARGE syndrome, which just to briefly orient you to it, if you haven't heard of it before, it is a tool that outlines the educational needs of students with CHARGE and provides some examples of ways of addressing those needs. So as I was saying, the checklist is a tool meant to educate on the different characteristics, the common characteristics of individuals with CHARGE and ways of addressing those in the school. So it's meant to be a tool to support the voice of parents and also a tool to help educate the professionals that are working with these students in school. So I'll kind of just briefly touch on some of the things that Jen already mentioned. What I really wanted to do here is just highlight the mentors that I've had throughout my graduate training. So Tim Hartshorn, who I've been working with since 2016, has been just an unbelievable mentor, and I would be, I can't go through a presentation without acknowledging that and the impact that he's had on my career. So he has been just a really great advisor and got me interested in CHARGE and has supported me throughout my my graduate training. So I'm really, really thankful for all of his mentorship. And working at Deafblind Central, Michigan's Deafblind project with our director, Beth Kennedy. She is just a phenomenal mentor, and I've continued to work with her, consult with her throughout my time since specifically working at DB Central, and she kind of got me really interested in the deafblind projects, and that's been something that I've just really enjoyed collaborating with deafblind projects since my work at DB Central, and I feel very lucky to have spent such a good chunk of time working with her. And then at the Cincinnati Children's Hospital with the CHARGE team, I worked primarily with Dr. Wiley and Dr. Chu, and they're excellent. And all of these training opportunities has really helped me grow as a professional and just really understand the needs of the charge community. And I'm always looking to collaborate more with other professionals to continue to expand my capabilities individually as a professional. So just to give an overview of the presentation today, I will start off with a brief rationale for the checklist, why we decided to develop this. I will briefly talk about how we went about developing the checklist. I will talk about the checklist itself. That will be the bulk of the presentation. And then I'll talk about how you as professionals can use the checklist. So we already did this part about for me to gauge the different types of professionals that are here. It looks like we have a really wide range of professionals, which is really, really cool to see. I'm hoping that we'll have some good conversation throughout this. And if anyone thinks that, if anyone wants to reach out to me after the fact, I love hearing from people who are at the presentations for collaboration or for your input about how I can improve my future work. I think that's the most valuable part for me about doing these presentations, is establishing different collaborators. So I know that many of you have experience with CHARGE, but I want to start with a brief overview of CHARGE syndrome. So CHARGE is a genetic syndrome occurring in approximately 1 in 10,000 to 1 in 15,000 births, so it's relatively rare. We now know that it's caused by a mutation in the CHD7 gene, which was discovered in 2004. The term CHARGE was coined in 1981 based on what the most common characteristics of the syndrome were at the time. So I'll briefly go through those. C stands for coloboma of the eye, meaning a portion of the eye that is not completely developed, and that can occur at in different portions of the eye, and the location and size impacts the degree of vision loss, which I'll talk about more later in the presentation. H stands for heart defects. These are congenital and often the first medical piece that is addressed early in life. So typically kids are going in for heart surgery, and they might need additional surgeries throughout their life. A stands for atresia or stenosis of the cone. So that is a narrowing or complete blockage of the nasal canal. Again, that is one that is medically corrected very early in life, commonly. R stands for restriction of growth and development. So kids with CHARGE are typically shorter in stature and have global developmental delays, especially early in life. G stands for genital hypoplasia, so underdeveloped genitals, and along with that, we often see delayed puberty. And E stands for ear abnormalities and deafness. So this is one of the most characteristic pieces of CHARGE, is the ear abnormalities. So we see this at the inner, middle, and outer ear level. And with those different abnormalities, we see varying degrees of hearing loss, which can vary from ear to ear. So we've learned a lot about CHARGE syndrome since it was first discovered and described in the 1980s. So we now diagnosis is made on the basis of major and minor criteria and the presence of the CHD7 gene mutation, although the mutation is not required for a CHARGE diagnosis. And something that's really important to know about CHARGE is that these kids are extremely variable. Kids are going to vary on what characteristics they have and also the severity of those characteristics. So we like to say in the CHARGE rule that if you've worked with one kid with CHARGE, you've worked with one kid with CHARGE. So the purpose of the checklist really is to focus on what the individual characteristics are that the students present with and how we can address those specific needs. So I never want to think people to think with this checklist that we've made this tool that is just a cookie cutter tool that can be used with every kid with charge. You really need to, it's a starting point, and it's a way that you can narrow down, kind of focus in on your energy on some specific characteristics that you think are most relevant to the student. All right, so the rationale for this checklist. As I said, charge is really low incidence, and it's really complex. There's so many different components of charge that can make educational supports really, really difficult to fully capture the student. And because it's so low incidence, educators might not have experience working with students with charge. A lot of times parents will tell us that when their kid first starts at school, that the team has never heard of charge, and sometimes they feel like they have to completely educate the school professionals on what charge is, because it's very rare. And they have the same experience with a lot of the medical professionals as well. So they're used to this. And unfortunately, something that we have heard a lot in our lab and from consulting with a lot of parents is that parents don't always feel heard by educators. Parents are really used to being in that the advocacy role, and sometimes they don't really feel like they're being heard by educators. And I'm trained as a school psychologist, so I also see the other side of it. I've worked on school teams, and I know that a lot of times it can be kind of a miscommunication where parents are really advocating for what they think their child needs, and the school professionals there's a lot of constraints that they have to work around. So I completely acknowledge that. And I also know that with the educators that are here today, I just wanted to take a moment to thank everyone again for coming. I think this is exactly what parents want. Parents want school professionals that come and take the time out of their day to come and learn more about their child. So if any of you are working with kids with charge, I know that the parents will really, really appreciate you taking the time to do this. And this is what I would want to see out of professionals, taking the time to learn more and expand their understanding of charge. So that's kind of the rationale. We know that it's really rare, and there's historically been a contentious relationship between families and educators. And in the 2017 Charge Conference, I heard of this new checklist that just came out. It was called the Charge Syndrome Checklist, Health Supervision Across the Lifespan. And it's a tool that was put together for medical professionals to outline the different common medical characteristics of charge, and when the medical professional should be checking for those different characteristics across the life. So I know this is probably difficult for people to see, but this is a screenshot of what the checklist looks like. So it's broken down into different categories, and it's shaded in for different times of life based on when medical professionals should be screening or assessing these different areas. And when I heard about this at the conference, I thought, this is what we need for the schools. We need to make something that kind of provides an overview of the different educationally relevant characteristics, like the spread of characteristics seen by kids with charge, and provide some guidance of how to address these in schools. Because at least all the educators I've ever worked with, everyone wants to do good for the students that they're working with. And I think with the time constraints of many educational professionals, I thought that we really needed a tool that's concise, that brings all of the information together, because there's so much information that's spread out there, and I know that educators don't always have the time to be scouring the internet for all the different information for one specific student. So are there any questions? I'll check in before I move on.
I don't see any new questions in the Q&A or in the chat right now.
Okay, thanks, Michelle. All right, so moving on to how we actually developed the checklist. So we had this idea of adapting this medical checklist to the schools, and how we went about it was we tried to collaborate with as many people as possible to make it into something that was reflecting the needs of the people that would be using it. So first, the Chart Syndrome Research Lab at CMU, the lab that I'm a part of, was really pivotal in helping with this. So the lab is led by Dr. Tim Hartshorn. There were 4 school psychology doctoral students at the time and 5 undergraduate students. So the checklist was informed by a literature review of professional recommendations, which I conducted in the fall of 2017. And the next step was going through my lab and running ideas off of them for the formatting and kind of tweaking it before we moved on to the next step. I also worked really closely with a panel of experts who rated the checklist at every stage of development and provided recommendations on aspects to add, remove, or change. And I could talk at length about each of my panel members. They are so excellent. But I will just briefly run through their names because I could do a whole separate presentation just talking about how amazing all of them are. So David Brown, educational specialist formerly with the California Deafblind Services. Beth Kennedy, director of Deafblind Central. Rob Last, special education teacher specializing in sensory disabilities in Australia. Jude Nicholas, clinical neuropsychologist specializing in deafblindness in Norway. Nancy Salem Hartshorn, an expert in assessment of individuals with charge and a parent of a now 31-year-old with charge. And Casey Stratton, the head of the Mississippi State Charge Lab. So with this panel, we had a pretty interdisciplinary team. We had people with experiences with the deafblind projects. We had educators, we had psychologists, we had parents. So we were trying to pull from some big groups that would help inform this checklist. We then, after we had a draft of the checklist, we sought feedback from a select group of parents, professionals, and State Deafblind Project employees. So we, for the parents, we recruited them from the Charge State Family Liaisons, and we got pretty good representation there. The professionals were recruited from Western Pennsylvania School for the Deaf, Michigan School for the Deaf, and Perkins School for the Blind. And we had a nice spread of professionals too. We had an audiologist, teacher consultant for the visually impaired, job coach, multiple sensory impairment teacher consultant, speech language pathologist, principal, health and physical education teacher, general education teacher, interpreter, and intervener. So I was really happy with the range of professionals whose input we received on this. And then we also received feedback from 2 State Deafblind Project employees. So the select group, again, provided feedback on if there's anything they thought we should add, remove, or change about this more finalized draft of the checklist. So that's kind of briefly how we developed it, just so you know the background of the tool. So moving into the checklist itself. So the checklist consists of an introductory page, which I will go more into, the actual physical checklist, which consists of 5 categories or columns, 27 of the common characteristics and concerns, which are broken into 5 subsections or domains, a glossary of some of the more jargony educational terms and charge medical terms, and a selected reference list for recommended resources. The introductory page provides an overview of charge, and it provides an overview of the 5 educationally relevant domains, which I'll talk about in the next couple slides. And it also provides an overview of the checklist and how we recommend that it is used. So when I am conceptualizing the educational implications of charge, these are the domains that make the most sense to me. So I'll spend some time talking about these now. So for the medical domain, we know that charge is a really medically complex syndrome. So during the first several years of life, these kids are undergoing numerous hospitalizations, surgeries, and procedures, which often require really long hospital stays and recovery periods. And so their early development is really shaped by all of these consistent procedures, and that has a really profound impact on their ability to interact with the world, because they're constantly undergoing these different procedures. And often these medical concerns persist throughout their life and impact their ability to access education. So the impact comes from having to miss school for procedures or for recovery periods. It has to do with having these medical concerns that inhibit their ability to focus. And with these medical components, the medical pieces are always going to take priority over the educational pieces, because if they're not medically stable, there's no way that they're going to be able to access the education. So a lot of times with these medical pieces taking the first several years of life, these kids are missing out on a lot of educational experiences that their peers are getting. So kind of right off the bat, they are often coming to school a step behind, because they've missed out on these really crucial times. And that's one of the reasons that early intervention is extremely important as soon as they're medically stable. And also the medical concerns are often managed at school. So it's really, really important for educational professionals to, even if they're not the ones directly managing the medical concerns, it's really important for them to be aware of these different concerns and how it might impact the student's ability to focus or the services that they're directly providing. Next is sensory, and individuals with charge have multiple sensory loss. So their vision, hearing, taste, smell, sense of touch, proprioception, and vestibular senses are can all be impacted. And it has a really significant impact on their ability to learn, because schools and the world in general are set up for people with fully functioning senses. So when students don't have full access to those different sensory systems, it makes it difficult for them to access information if schools and educational professionals don't specifically think about ways that they can increase access through the different sensory systems. So schools really need to adjust their teaching strategies to make them accessible for students with sensory loss, because you can't, you have to think a little bit outside of the box, because a lot of the typical teaching strategies just aren't going to be accessible to these students. And it's really important to maximize sensory input, because how we learn is through interacting with the world and exploring our environment. And so if we're not getting that information, we just don't have the opportunity to learn. So access is extremely, extremely important for students with charge. And then communication. So kids with charge often have difficulty with communication due to, in part, the sensory loss, and then also due to the structural anomalies. So coinaltresia, the cleft lip and palate, which are really common characteristics of charge, they can make it really difficult for students to be able to express themselves in a way that's understandable to people beyond their immediate family or people that know them really, really well. And with the sensory loss, they also have difficulty receiving information. So with the hearing loss and vision loss, they're missing a lot of cues for the receptive communication. And where the general recommendation in the literature is to develop a total communication system. So that means communicating in any way that is accessible to the student, and making as many different ways, different avenues as possible to maximize communication. So it's really important to meet the student where they're at and expand on it. So it's the students with charge are commonly, they're used to being kind of in their own world because that's what they have access to. So it's our job to meet them where they're at and kind of expand the world for them by providing access to them. So some of the common strategies here are using a combination of spoken language, sign language, pictures, touch cues, definitely interpreting any behaviors as really key communication, especially for those who don't have as much expressive capacity. So yeah, communication is a really, really big piece for schools to target. And then developmental. So due to the time spent in the hospitals early in life, multiple sensory loss, and different structural anomalies, we typically see global developmental delays in kids with charge. And it's really important that school teams see these as delays and areas that can be built upon through early intervention. So early intervention is extremely key in addressing these delays. And we should always be focusing on the strengths of the child and seeing how far they have, seeing the potential of the students instead of just focusing on all of the delays that they have, because there are going to be a lot of delays due to just how medically complex they are and the multiple sensory loss. So it's our job as professionals to provide access to learning opportunities and to provide support to address those delays. And then behavioral. So we know that a lot of students with charge have some pretty severe, challenging behaviors. There is a behavioral phenotype that Tim Hartshorn came up with, which outlines the main kind of charge behavioral characteristics. So these include low normal cognitive functioning, being socially interested but immature, having repetitive behaviors which increase under stress, a high degree of sensation seeking, the tendency to lose behavioral control and self-regulation when stressed or sensory overloaded, and lastly, difficulty shifting attention. So this phenotype is not, every single one of those items is not necessarily going to be seen by every single student with charge. However, generally students are exhibiting several of those. And what we always say in our lab is that behavior is communication, especially for those kids who don't have as developed expressive communication. Sometimes these challenging behaviors are their only way of expressing to others what they want and need. So it's really, really important when addressing these behaviors that we acknowledge that their behavior is serving a communicative purpose, and not to try to remove that behavior without giving them another alternative to communicate. Because the last thing that we want to do is remove an avenue of communication for these students, because their avenues are already limited. So it's really important to kind of learn those really nuanced cues of these kids and try to figure out what they might be communicating by these subtle different behaviors. And this is just a picture of the introduction page that kind of describes what I've just described. So it provides an overview of charge and then kind of just a couple sentences on the different domains that I just mentioned. Are there any questions before I move on?
This is Michelle. I don't see any questions in the Q&A or the chat.
Okay, thanks, Michelle. So then just provide a brief overview of the checklist, which I'll show you a picture in the next couple slides, so it will kind of make more sense of what it actually looks like. So these are the 5 columns of the checklist. So first, the characteristics and concerns are the educationally relevant characteristics and concerns that, or difficulties commonly exhibited by individuals with charge. Educational or support needs, these are the needs that are resulting from those specific characteristics and concerns that need to be addressed in school. The team members are the educational professionals who might be involved in addressing that specific concern and meeting that specific need. Examples of strategies and accommodations. These are a limited set of strategies pulled from the literature and professional recommendations that can be used to accommodate that specific educational need. And we are very specific in our wording on this, that these are meant to be a starting point to jump off of and really to tweak to meet the individual student, because like I said, students with charge are extremely variable, so by no means could we come up with a list of strategies and accommodations that are going to work for every single student, because it's just not possible. And the team members have an important role of kind of trying to figure out how to address all of the needs of these students. So these are meant to kind of just get the ball rolling and provide some examples based on what professionals recommend, professionals who have experience working with charge. And finally, consulting professionals are professionals outside of the school who might provide additional support through providing assessments or providing recommendations, but they're probably not going to be involved in the day-to-day service delivery. And here is a picture of that part of the introduction, providing an overview. And this is just a picture of the checklist itself. So this kind of helps put it into context. So as you can see on the top row, we have the 5 different characteristics. There's also a column to the right of the characteristics and concerns where parents or professionals can go through and put a check mark on the characteristics that the individual student has. And on the left, you can see that these are the characteristics that are grouped into the medical domain. So each of the domains that I talked about, they're grouped within the checklist. I think I see some questions popping up. Michelle, if you wanted to speak those.
This is Michelle. A participant's just talking about the fact that they just realized that their adopted son from China most likely has charge.
Interesting. Yeah, that's maybe we can talk more about that at the end. That's and hopefully this will provide some context for you as a parent too. Okay, so the next bit of the presentation will be, I'll go through some specific of the most common characteristics and concerns, and I'll kind of walk through some examples of the support needs and strategies. So this is, I'm not going through every individual characteristic because there's 27 of them and we don't have time for that, but I've tried to pick some of the most common ones. So starting off with feeding issues. So gastrointestinal issues, specifically feeding issues, are really, really common in kids with charge. In the literature, it's been cited up to 95% of kids with charge have feeding issues. And that is something that is likely to need to be addressed in the school. So one of the educational support needs that arise from having feeding issues are the need to have the schedule and location of feeding predetermined. and for school staff to understand issues with chewing and swallowing and to receive training in the specific mode of feeding that the individual uses. So the team members that might be involved here are school nurse, lunch staff, speech language pathologist, behavior consultant, occupational therapist. And I should note, under the team members, we've included that parents, special and general educators, and interveners should be consulted in most areas, because those members would basically be in every single category. There are some areas where we explicitly labeled them again, just because that really is their specific area, but those team members are going to be really important for basically every single one of these.
Lily, there is a question.
Yes.
Ms. Michelle, is this a checklist designed to hand out to teachers, or should it be paired with an in-service?
So it is designed, so typically how it's been used in the past is that parents will check off the characteristics that their child has, and then it's provided to the school team, who can use it to kind of learn a little bit about charge, and like use the future or the recommended resources to look more into the different areas. So it's kind of meant as a conversation starter for school teams when thinking about different services that they can provide students with charge. So I personally have not done a specific like school team training on this before. I would definitely love to in my career. I am just not, I personally can't do that right now as a graduate student, but I'm hoping that in the future I would love to do more like trainings like this. I know in Michigan, our Deafblind project will go out and do team trainings for all their students with who are deafblind, but specifically kids with charge. And I know that they use this checklist in kind of helping guide that conversation. Does that make sense?
This is Michelle. It makes sense to me, and as a deafblind project, I think it is something that could help guide a conversation and engender a lot of team discussion.
Yeah, and I've received feedback from some parents and professionals that that it did serve that purpose of kind of starting the conversation and like just helping school teams wrap their head around like how do we go about addressing the complex needs of this student. So this isn't just a comprehensive training because the real work lies in the school team meetings, but it's kind of just meant to guide the conversation and get the team thinking about different possible ways that they could address these needs. So some examples of strategies and accommodations for feeding issues are to specifically do feeding therapy. So that's something that could be written into the IEP as specific goals, cutting food into small bites, and training staff on feeding. And some consulting professionals outside of the school could include a primary care physician, medical specialist, and a dietitian. Next up in the medical domain is chronic pain. So chronic pain is thought to be experienced by pretty much every student with charge. With so many medical complications, there's just a lot of things that typically cause them pain. So what kids really need surrounding chronic pain is for their school professionals to recognize their pain behaviors, and also they have a need of medication management often, which is often managed at schools. So the team members for this could include a nurse, school psychologist, and behavior consultant. And some examples of strategies and accommodations could include a functional behavior assessment, so trying to determine, keeping track of the different behaviors that are happening throughout the day and trying to determine if there's a certain pattern there surrounding specific like medical procedures or instances in which you know that there's pain. Second is interpreting pain behavior as communication. So like I said, while a pain behavior might not be necessarily ideal for educators or professionals in the school, it's serving a purpose to communicate the behavior to others, or the pain to others, which is, they might not have another way of doing it. So I definitely see the importance of giving them more adaptive ways of communicating, especially ways that aren't going to further harm themselves. But we really need to be tuned into those pain behaviors and what they might be communicating. The school team will likely be involved in medication management, and like I was mentioning, a really good goal will be to teach the student how to communicate pain. I think there's a lot of ways to go about that, which would be very individualized to the student. And then consulting professionals, which I should have mentioned, the State Deafblind project should be consulted in most areas. Since the professionals here are on this call, they probably are well aware of the State Deafblind projects, but I think that the Deafblind projects just have such a wealth of knowledge to provide to school teams. And I think it's just, I've been in on IEPs where the Deafblind projects have been involved, and I just think it's so crucial, and it's really, really powerful to have a team that includes the Deafblind projects, because they just have so much information and support to provide. The consulting professionals here could include the primary care physician and medical specialists. All right, moving into the sensory category or domain. So ocular defects or vision loss. So this is typically coloboma, which again, that the size and location impacts the degree of vision loss. So typically in kids with charge, they have a visual field loss, an upper visual field loss, meaning that they don't access or they cannot see a specific part of their visual field. So like it would be as if they're not gaining information from a certain portion of their eye upwards. So what they need due to vision loss is access to the visual environment. So providing alternative ways of accessing what you're typically seeing. Educational professionals need to understand functional vision and how the individual uses their functional vision. It's really important to understand the risk of retinal detachment, which is common with colobomas. You need to understand equipment management for vision loss, understand light sensitivity, and understand the visual field. So a lot of the support needs here come from understanding the specific needs of the student and how they use their vision, and how they can accommodate the school environment to accommodate for the vision loss. So team members here will likely include teacher consultant for the visually impaired, certified orientation and mobility specialist. So those will be really, really key players here in increasing access and teaching the student how to navigate their environment. Examples of strategies and accommodations. Functional vision assessments are going to be really important for learning how the student uses their vision and how educational materials should be presented to them. Learning media and assessment to determine what devices they use. Environmental accommodations such as using large print, braille, angled work surfaces, consideration of lighting, making sure it's not too bright or not too dark, and then minimizing visual clutter are just a couple of the examples of ways to accommodate the environment. Glasses might be used, And also it'll be really important to establish a communication bubble, which is the area around the child in which they can most easily access communication. And it's really important that all of the school staff be on the same page with that and be aware of the communication bubble, so that they know like where is the child's visual field and where should they be providing them with information. And then consulting professionals would include ophthalmologist, optometrist, low vision specialist, and the state deafblind projects. And then auditory issues or ear abnormalities. Like I said, this occurs in the inner, middle, and outer ear. So the support needs here include access to the auditory environment, understanding the degree and type of hearing loss, and equipment management for hearing loss. So this is very similar to the vision loss section. It's really important that school professionals understand how the student is using their hearing and how they need to accommodate it to make sure that they're increasing access. Team members will likely include a teacher consultant for the hearing impaired, and some strategies will likely include a functional hearing assessment, providing or ensuring that the student is using assistive technology such as an amplification system and hearing aids. And something about the FM systems is it's really important that those are consistently used across the schools. We've heard from some young adults with charge that the FM systems weren't used by some of their teachers, like when they got to middle or high school. It was more on them to like set it up, and that makes it so they aren't fully accessing the information. So it's really important to have consistent access across the different settings and the different classrooms. Understanding of medical interventions such as cochlear implants or BAHAs. Also important to minimize auditory distractions and provide access to sign language. And consulting professionals will likely include an audiologist, ENT, and the state deafblind projects.
Lily, it's Michelle. There's a few more questions or comments here now. Let me here get them. Okay. This comment came in regarding the area of pain. The comment is, we had a student with charge that the team taught to sign medicine when she was in pain. Mm-hmm. It was an easy sign for her to make, and she used it consistently.
That's awesome. I think that is a really great example of a way that you can do something that is really manageable for the student, and it's, you know, that's something that can, it's much easier to get the entire team to know the sign for medicine than to learn the very intricate pain behavior. So that's a really, really great example.
Here's another comment, and it says, for ocular strategies accommodations, what about suggesting a mobility evaluation?
Yeah, that is definitely a good one to add, and I'm going to make a note of that. And so I guess I should have said earlier too, I see this checklist as something that should be constantly evolving. So I have a Word and a PDF document of it, so I can very easily make changes to it. So I will definitely, after this, go and add a mobility assessment to it. I think that's a great idea.
And there's one more comment. I don't know if you want to address it now or later, but I'll give it to you now. And it says, do you feel that students with charge should have a one-to-one para while at school?
Yeah, I'll address that now. I think, of course, that's going to depend on the individual student. I think something that I really see the value of is our deafblind interveners, which I don't know how common those are in the specific states that people are in, but deafblind interveners are, they work one-on-one with students who are deafblind, and they have specific training in deafblindness. And They work to provide access to the student. And I think that interveners play such a crucial role across the different across the school day. Not every student with charge is going to need an intervener, but I think especially when they're in their younger elementary years, I think they're so crucial for just providing access and being a person who understands their behaviors and can kind of like provide a bridge between them and the classroom throughout the day. So yeah, it's going to be an individual decision, but certainly one that I think could be warranted in many situations.
Those are all the questions right now.
Okay. I guess I want to do a quick time check. I'm kind of taking questions during it. Do you want, should I kind of speed up the next couple slides so we have more time at the end, or I know we got started a little bit late.
Lily, this is Jen. I think you're fine how you're going, answering questions as they come in. And then if we need to extend the time a little bit, we'll have that ability to.
Okay, great. I just want to make sure I'm not, I can talk about this stuff for days, so I want to make sure I'm not talking too much. Feel free to cut me off if I'm going too long. Yeah, and thanks for the questions, everyone. Those are great comments and questions, so keep them coming. So the next area for sensory is deafblindness. So we've talked about vision loss and hearing loss separately, but this is probably one of the most crucial rows of the checklist, because as we know in deafblindness, it's not just vision loss plus hearing loss. It's really it's so much more than just vision loss and hearing loss. It really, like, the effect of each really multiplies, because kids or individuals who have a combined vision and hearing loss, they have a reduced capacity to rely on the other senses to supplement the information in their environment. And so that, paired with the other sensory difficulties of kids with charge, it's a really profound impact. So it's really important it's really important for our vision specialists and our hearing specialists to work together to ensure that we're really comprehensively addressing the needs of these students. So educational and support needs, the number one is access to the environment. So like I mentioned, our world is not set up for people who are deafblind. It's really set up for people who have typically developing senses. And if students who are deafblind can't access the environment, then there's not really much that they can do with it. So it's really important to provide that access and try to think of creative ways to help them interact with the environment. Next, it's really important that team members understand the complexity of combined vision and hearing loss. And it's important to have knowledge of deafblind specific interventions. So again, like, not just using strategies that are that have been used for students with just vision or just hearing loss, but really looking at the intersection. Team members here likely include a teacher of the deafblind and an intervener. And I just think interveners are such an important team member, and I hope that one day interveners are much more widespread and accessible than they are now. I think that every student who's deafblind should have the option of having an intervener, and unfortunately that's not the case. I know a lot of parents have to fight really hard to get an intervener for their child. Some examples of strategies and accommodations are to simultaneously address the impact of visual and hearing loss. So again, not just looking at it in isolation, but looking at it together, and how can we address them at the same time, or how can we at least make sure that we're considering the loss of one while we're addressing the other. Again, it's really important to make information available through multiple sensory systems. You never really know which sensory system is going to be the most accessible to a student at a given time. that really waxes and wanes. So it's important to always be giving information as many ways as possible, because you never know what piece they're going to be able to supplement with in any given moment. And direct instruction is really important. So people with typically developing senses learn the majority of information indirectly or incidentally. And for students who are deafblind, it's much more difficult to learn incidentally because you're just not getting the access from the environment. So it's important to make really direct learning experiences and making it as concrete as you can. So a really good example of that is making an experience box. And you can use these to supplement storybooks. And so picking out specific items that correspond with the storybook to make it more concrete, so that they're not only getting they're not only hearing the book, seeing the book, using Braille or accessing it via sign, but they're also getting to have like a tactile object to connect it to. And then consulting professionals, state deafblind projects, ophthalmologist, and audiologist. All right, next is the under sensory is the vestibular system impairment, which is the balance system. And this is, again, one of the most impactful educationally, at least in my opinion, like the combination of the vision, hearing, and vestibular system. And why I think this is so impactful is that it's something that's really, really hard for educators to see. It's really hard. You can see that someone, you can see the direct impact of vision loss or hearing loss, but the balance system, it's much more abstract, and it's harder to tell when that's impacting a student.
Lily?
So, yes.
Sorry, it's Michelle. There's a question.
Okay.
Do you have a specific resource to learn more about deafblind interventions that target both and not one or the other in isolation?
I can, I think I do. I'll look in my, I have like a folder of all my resources. So I can look at that and send it after the presentation. I know that I'm thinking of some of the articles from some of the different deafblind projects. So what would be the best way for me to provide that? Can I send it in an email afterwards, and it can be sent out to the participants, or?
Sure, Lily, this is Jen. That would be wonderful. If you want to send it to me directly, and then I can get that in the follow-up email.
Okay, great. Were there other questions, Michelle?
Whoops. Another participant just mentioned that she's a nurse for a student who has Charge syndrome who uses a tracheostomy.
Awesome. I don't think I've said this yet, but I think that nurses play such an important role, and that's something that I would really love to research more. When I was working at Cincinnati Children's last summer, there was several of the patients coming in had a nurse that worked with them at home and at school, and the nurses were accompanying them in the appointments, and the level of understanding that the nurses had of these students was just unbelievable. And I think the ability to have a nurse that goes with the student from home to school is just such an amazing opportunity. So I think that school nurses have such an important piece to play here. So I'm glad that you're here in the presentation. So sorry, Michelle, was there anything else?
That's all.
Okay. So with the vestibular system impairment, some educational support needs resulting here are the need for supported balance, independence of mobility, so supporting their ability to move about their environment, And then understanding the need for unconventional positions, such as lying horizontally or upside down. And that is something that's really important because that's something that is often not understood by professionals. We've had many parents come to us saying that the schools will not let their child hang upside down or lay in these different positions. A lot of times we think that, for example, if a student is going like this while they're listening to a presentation or listening to the teacher, so having their head resting on their hand, the teacher might assume like, oh, well, they're not paying attention, especially in combination with the visual field loss. So they might be have their hand on their head, and it might look like they're looking right out the window, but really that's the position that they have themselves in that they can most efficiently focus on their teacher. So understanding that these kids really do need these different positions to be able to focus the best. So the upside down position, especially, that's one that a lot of kids do, and it's thought to be because it stabilizes their head, so they don't have to expend so much energy focusing their head, so they can really just focus on looking at the teacher and accessing the material. So that's just it's extremely important, and that one is such an easy fix of just letting the student sit how they want, so that they can access the information. Team members here that will likely be involved are a physical therapist and occupational therapist. And some examples of strategies and accommodations could include vestibular system stimulation, so swinging and rocking, providing opportunities for movement. So a lot of kids with charge, they kind of like wobble when they walk, but they can run just fine. So giving them those opportunities to move and kind of like stimulate their vestibular system is really, really important, and is thought to make them a little bit more, like increase their capacity to be able to focus during the times where they need to focus. Providing appropriate physical supports. So providing chairs that have arms on them so they can stabilize themselves, providing chairs that have feet supports so they can, again, like center themselves and stay balanced, or providing other supports in which they don't have to be seated in a chair, that they're allowed to lie on their side or lie upside down to access information. So the physical supports goes along with the seating accommodations, and then support for walking. So another team member that would be really important here is orientation and mobility specialist. So learning how to use their environment, learning how to navigate their environment, and given their balance difficulties. And consulting professionals might include an ENT. All right, so moving into the developmental area. So delay in intellectual or cognitive development. So support needs here are curricular modifications, encouraging exploration of and access to the environment, and recognizing the potential of the child, and supporting concept development. Team members that might be involved here are school psychologist and teacher of the deafblind. And some examples of strategies might be to modify the curriculum through accommodation, adaptation, making the curriculum parallel or overlapping. And again, direct instruction of functional skills is really important. I think it's really important in this area to focus on what the child's and the parents' long-term goals are, and starting to work on those functional skills early is really, really key. I think sometimes we wait until like the transition age to start really focusing on those like functional skills or skills that are needed for independence, but these are things that we can be including from early elementary. So I think it's really, really important to always think about what this is going to look like 10 years down the road and how this is going to build on their later goals and needs. Some consulting professionals might include a licensed psychologist and the state Deafblind projects. So posture, I'm going to kind of breeze over because I talked about that quite a bit already. But kids with charge often have unconventional postures, or they will sit in different kind of ways that you don't typically see. So basically, just understanding this and allowing the student to sit in a way that allows them to best access their educational material. Social skills is something that's really, really important. So that's part of the behavioral phenotype, is that they're socially interested but often immature. And the reason for this is that they're missing out on so much information due to sensory loss. They're not as easily able to see their peers interacting or see the faces of their peers to gauge emotion or like body language. They might be missing like auditory cues for someone saying hi to them. So they're missing out on a lot of this information. But that doesn't mean they're not interested. So the educational or support needs are the opportunity for social interactions and the need to develop a positive social community. So it's really important. I think this one I see as being a more like systems level intervention and developing a good school culture and a culture of inclusion. Team members here will likely include a school psychologist, social worker, speech language pathologist, and teacher of the deafblind. And some examples of strategies and accommodations here are to create a circle of friends. So what that does is it identifies students in the class that kind of form a circle of support around the student with charge, and they learn more about charge syndrome, and they learn more about the specific student and what they like and don't like, and they kind of they act as social support and are specifically challenged with, or it's their role to include the student and make sure that they are involved in the classroom, like socialization. So Tim Hartshorn, my advisor, he and his wife Nancy implemented a circle of friends with their son Jacob when he was in school. So what that looked like was there was like 5 or 6 students in Jacob, their son's classroom, who were like Jacob's circle, and they would go around and do his. They would eat lunch with him, like they would play with him at recess, and it became kind of like everyone wanted to be in the circle, and it was like the cool thing to do was to learn more about Jacob and be a good friend to him. So I think that really goes with like a culture of inclusion in a classroom. Social stories are another strategy that are commonly used with kids with charge. A social story kind of explicitly breaks down different social expectations or specific like big events that are coming up. So these work really well when they're individualized to the specific student. So for example, like if you were making a social story for a student who's going back to school in light of COVID, the story might say like, oh, Lily's going back to school in September. She's going to have to wear a mask to make sure that she's keeping herself safe, and her friends are going to be wearing a mask too, and here's what the expectations are, and here's what you might expect. So social stories basically line out the expectations of what's to come for the student, and also kind of it's centering them in the story, so it's kind of fun, and it kind of just like lets them know a little bit of what's coming. And then teaching social emotional skills curriculum is really important. Again, these can be taught explicitly. So there's plenty of social skills programs out there that are really great, and a lot of times these kids just need a little bit extra support in this area. They're really motivated for it. They might just not have the skills to know how to navigate these situations. And then consulting professionals include a licensed psychologist and the State Deafblind Project. And then I am going to skip past motor. I think it kind of fits into some of the other topics that we've talked about. If anyone is more interested in some of these topics, you can feel free to email me. I just, in the interest of time, I want to make sure I'm covering some of the other areas that I haven't touched on as much. So communication, receptive communication, meaning the information that the student receives and understands from others. Often there's difficulties here due to difficulties hearing, difficulties seeing, and motor issues. So an educational or support need here is to communicate via numerous sensory channels. Like we've talked about previously, using a total communication system, like they really just need access to lots of different types of communication. Team members might include a speech language pathologist, sign language tutor, an intervener, and a school psychologist. And again, some strategies include using a total communication approach, providing time to process information and respond. That's huge. So we call that deaf-blind time. A lot of times, even with typically developing kids, we ask them to do something, we expect them to do it really quickly like that. And it's not really realistic, especially for someone who has multiple sensory loss. It's really important to give them time to process the information and then make their response. Consulting professionals might include a licensed psychologist and State Deafblind Project employees. And expressive, I am going to kind of just briefly touch on this because it's very similar to receptive in terms of offering multiple opportunities for communication. It's really important to create a responsive environment, though, for the student, so that when they are learning how to communicate, they're immediately getting rewarded for that, or like they're immediately seeing the results of their communication. And offering and being consistent with AAC devices is really, really important. And the last one that I'll go over as a specific example is behavior. So like I said, kids with charge can exhibit really, really challenging behaviors. One example is physical behaviors, so scratching, hair pulling, biting, self-injury. So what these kids need for that is for professionals to do an environmental scan and make environmental accommodations, try to identify the reasons for behaviors, including any pain, sensory, environmental needs, and determine the importance of it and immediacy of intervention. So something that is talked about in the literature is that is this behavior just something that is annoying to me, or is this something that is actually dangerous to the student that we really need to intervene upon? If it's more just annoying, then is that something that we can tolerate and maybe like try to work with in a more supportive way than just trying to get rid of it? Team members here might include a school psychologist, behavior consultant, and teacher of the deafblind. And some strategies might include a functional behavior assessment, interpreting behavior as communication and building upon that communication. Along with that, addressing the behavior without taking away communication, and always considering pain and anxiety when working with behavior. And here is just a screenshot of a part of the glossary. Like I mentioned, it provides some of the just explanation of the school jargon and the charge jargon for professionals and for parents. And then our selected reference list. All right, and then so actually using the checklist, how this should actually be used in practice. So I think a big use of this is to use it to learn about charge syndrome. There's a lot of information in here about the different characteristics of charge and strategies of accommodating those needs, as well as other resources. So I think it's kind of meant to be a consolidation of all these resources that are out there, because there's so many excellent resources about charge. I think the Charge Syndrome Foundation has done a really good job of getting a lot of information out there, and there's a lot of professionals who have devoted a lot of time to writing about charge, but it's really, I mean, I can attest that it took me months and months and months to scour through all of that information and compile it all together. So this is kind of like the SparkNotes version, and if you want to look more into it, there are different avenues for doing that. This can be used when developing IEPs. So again, I just wanted to reiterate that this is a starting point, just to start conversations for developing IEPs and to provide other resources for looking more into different areas. And you can also use it to consult with other professionals. So if there's I think it's kind of helpful to get all the professionals on the team on the same page with, okay, these are our overall goals for working with this student, and how can we work together to achieve that. And I also want to say that I think the most important thing that you can do as professionals is to include parents as valued team members and really acknowledge and defer to their area of expertise, because they are very used to advocating for their child in the medical world and in the educational world, and they know a lot. And I think that it's whenever parents can be included as a really valued team member, I think that's just going to benefit the child so much, because they're the keeper of all the information about their children. There's so much to know, and it's really, they're the expert in their child. So it's just really, whenever you can, or however much you can include them, do so, because it's very valuable. I'm currently, for my dissertation, I'm looking at educational outcomes of individuals with charge. So I'm currently collecting IEPs to look to see if there are common accommodations that we missed in the checklist, and seeing how we can improve the checklist moving forward. So I think that kind of highlights that I really want to continue to make this a better tool for professionals and for families. So I'm always open to feedback. If you've used the checklist, or if you have feedback based on this presentation, I just want to make this the best that it can be for everyone involved. So I will not be offended if you give me any suggestions. I would really love them. So I don't know if we have time for discussion, but maybe some things for everyone to think about are just what strategies have been most successful when working with students with charge, and what resources or information you wish that you had to inform your work with students with charge. So that's where I will stop. And then if we wanted to have time for discussion, I'd love to take any more, any questions.
Lily, this is Michelle. Can I put your email address into the chat box?
Oh, yes, please do.
Lily, this is Jen. If there are no additional questions, we will go ahead and wrap up our presentation. Thank you so much for sharing the charge educational checklist with all of us today. Thank you for all of your work.
Sorry, Jen, there is one question.
Go ahead.
Okay. My district will be remote come this fall. Do you have any suggestions, tips when it comes to working with individuals with visual impairment remotely?
Yeah, I was just talking with a parent in the Charge Facebook group about that. There's some really great resources from NCDB, so National Center on Deafblindness. I will send those to Jen to send out to everyone. I think the virtual format is really not ideal for any student, and especially not for students with combined sensory loss. I think it's really really hard to figure out how to you know increase access to those students. So I will send you some resources on that.
There's one more question. I work in early intervention. Are there many deafblind therapists that work in early intervention?
I think that really depends on the area and on the state, or it depends on the state. I'm not 100% sure about that. I think in general there's not a lot of specifically trained deafblind professionals. I would say that the Deafblind projects are really would be my go-to for seeking out those resources. If there's anyone that would know about resources for that age group, it would be the Deafblind projects. But yeah, I don't know in general if how many early intervention specialists there are for kids who are deafblind.
Here's another one. Excuse me. I was unable to join at the start of the presentation. I missed the first 5 minutes. Do we have access to the checklist?
Yes, and I can post that in the chat again. This is Jen. There is a resource folder and it should be accessible to all. Within that folder, there is the charge checklist. There is also today's presentation and some other resources with website links and information on the different deafblind projects that were part of this presentation today. Well, I'm not seeing any more questions. If more questions come in, please interrupt. But again, Lily, thank you for all of your work and your willingness to share this great tool for IEP teams to use when working with a student who has Charge syndrome. As we close this afternoon, I would like to launch one last poll just to see your interest in having an additional presentation on the Charge medical checklist. So if you could take a minute and just click on your answer. So the question is just, would you be interested in attending a presentation focusing on the Charge medical checklist? And the options are yes, no, or maybe.
And there's another question. I heard you mention an intervener a number of times. My district has a few parents of students with Charge requesting an intervener. However, these students are functioning at a relatively high level. And my district works very hard at creating a learning experience that allows for as much independence as possible. Can you describe a student that would need an intervener in this school environment? And Lily, if you don't want to take that one, I will.
I'll take a stab at it, and then Michelle, I will definitely defer to you. I'll give my kind of my take on it is that I think that interveners are different than just a typical one-on-one paraprofessional in that their goal is really to support the independence of the students. So I've always interpreted interveners as really that is the goal. The goal is for them to provide access to the student and really promote and support their own independence. And I think, yeah, it is kind of tricky because typically we don't always think of, we think of one-on-one professionals as being a more restrictive support, but the goal of interveners is really just to bridge the gap in access and then provide and then help the students, help them increase their independence. And Michelle, I'll defer to you.
Yeah, I was just going to say charge syndrome or whatever the deafblind etiology, an intervener is specifically trained not to impede the independence of the student and to ensure that they have the access they need so that they don't depend on others to do things for them. So I would suggest, Kelly, that you contact your deafblind project. Not every state has intervention training or interveners available, but if they do, I would contact the state deafblind project about the process so that you can get information about what's available in your state or province or wherever you're at.
All right. We are going to put a survey in the chat. If you could just take a minute to fill out that survey, and remember, if you wanted to get credit or a certificate of participation, you need to fill out the survey as that's linked to the survey. We are hoping to get out the credit and the certificate of participation requests to you within the next week or so. And just remember, if you're requesting the ACVREP credits or the Illinois Educator Professional Development credits, you will need to have your 2 code words. So Megan is putting that second code word into the chat now. And just wanted to say thank you again for attending today's presentation of the Charge Educational Checklist. If you have additional questions or need support with this checklist or any other deafblind topic, please feel free to reach out to any one of us and or your state deafblind project.
And this is Michelle. For those of you who don't have visual access, the closing code for ACVREP is RULE, capital R-U-L-E, RULE.
And I see that there's another question in the chat just around ACVREP credit. So if you fill out the survey linked at the bottom of the survey, or the questions will take you to, if you click on the ACVREP credit, the information that you will need to input in order to obtain that credit. And you will need those 2 codes, the opening code and the closing code. And then that will be sent out to you. You will enter those codes right into the Google form that you fill out with the survey. The question was just asked, where do we send the codes? The survey is posted, but if you don't see it, it is all lowercase, https bit.ly//PROFSURVEY 2, the number 2. We will also send out just a follow-up email tomorrow with the survey link and the information that Lily sends us as well. All right, have a good night, everyone. Image description. A slide with a link resource and 5 titles and email addresses are displayed. The titles are all displayed in black, with the links and email addresses in blue. The first title is Presentation Resource Folder, and next to it is the link bit.ly//bit.ly/bit.t.p//bit.ly/bit.ly/bit.ly/bit.r. Underneath the link resource is the name Lily Slavin. To the right is her email address, lily.slavin@cmich.edu. Next is the Wisconsin Deafblind Technical Assistance Project with the email jennifer.gettelman, Gettelman, @wesp-dhh.wi.gov, written on the right. Underneath is Project Reach Illinois Deafblind Services and the email mclyne@philiprockcenter.org is next to it. Next is the Missouri Deafblind Technical Assistance Project with the email megan.burgess@msb.dese.mo.gov to the right. Lastly is Delta Gamma Center with the email address ralambert@dgc.kids.org.